Well, in Europe, I saw many people smoking, many of the young people using vapes. And this was a major health problem that I saw as I traveled to Europe, learning about all sorts of things, including the Protestant Reformation, World War I, World War II, how their country's been affected by the Soviets, how everything is happening over there. But it's still a leading cause of cancer, lung disease, heart disease, strokes. It damages blood vessels. So it's still damaging people. And I think for a while we really focused on the damage, but now we don't hear about it. We've moved to focusing on other lifestyle things, other things which are important, but cigarettes are still an issue. In Europe, I also saw mainly the younger generation vaping. Well, vaping, you're not smoking it. They usually carry around canisters, but it can irritate the lungs, can cause cough, wheezing, shortness of breath. Now, we're just now learning about it because it's sort of a new phenomena that's going over the world. And I saw this all over Central Europe. It's also addictive, especially the nicotine component. They carry different types of toxins, and some of these toxins and chemicals in vaping has been implicated with different types of cancers. Honeycombing, damage to the lungs. There's been reports of even the vaping devices exploding, causing problems. There's some have heavy metals like lead and nickel that are damaging to the body. Even in the development, it can affect our brain's development. These are all known problems of vaping. Maybe vaping might not be as damaging as nicotine, cigarettes, but we don't know. This is what we're going to have to find out about. Then there are the nicotine patches. And what a nicotine patch is, since the addictive substance in cigarettes is nicotine, the theory is that if you can slowly get off nicotine by less and less dose, you can sort of help with the addiction. But the patch does carry some risk in itself. It can increase the blood pressure some, the heart rate. It can irritate the skin. And in some people, the patches can cause changes in sleep patterns. But the patches aren't near as dangerous as a vaping, not near as dangerous as smoking a cigarette. But now I've got some interesting information to share with you. And there's been several reports out there that everyone knows about the post-COVID syndrome, long COVID. We've heard much about COVID, how it, the spike protein damages body. There's people that are suffering from long COVID. Well, there's been several case reports of people that suffer from long COVID. What's happening is they have an impaired acetyl orchestrated neuromodulation. Well, basically, that's a really big fancy word that says, something related to COVID-19 and everything that went to it's blocking these nicotinic acetylcholine receptors, and this is causing problems. Okay. So they've studied some people in just studies that have nicotine patches for this. And what they wanted to know is, first, is the post-COVID-19 syndrome a severe impairment of this acetyl orchestrated neuromodulation, and that responds to nicotine administration? So what they've done in these case reviews now is now these don't necessarily have to be smokers, but they put nicotine patches on people. They do have side effects and risk, but they've studied them, and a lot of them show improvement in symptoms and rapid getting back to normal. And it says in this article that I'm reading, and you can join this too if you want this, it's in the Bioelectronic Medicine, and it's just a case report. These are just case studies, but there's numerous out there. And they said in all, they studied 4 people with the long COVID, that in all 4 cases they studied, they put the transcutaneous nicotine led to a near immediate improvement in symptoms, and the patients improved dramatically as they had this post-COVID-19 syndrome.